Tonight, KARE 11 has confirmed a federal investigation is underway to Evergreen Recovery. That's the Twin Cities addiction treatment facility at the center of a KARE 11 investigation.
As our team continued to dig, they uncovered tens of millions of tax dollars going to Evergreen Recovery to provide treatment that former employees and clients say has not always been provided as claimed. Here is AJ Legault with the latest findings in Recovery, Inc.
At Evergreen Recovery in St. Paul, each week, hundreds of people battling addictions come and go.
So we take people who are basically thrown away by society.
David Backus and his wife, Sean Grigo, are Evergreen's owners, while their clientele certainly have struggles. On social media, the couple appears to live the good life. Designer clothing, luxury hotels, travel on private jets, a $200,000 vehicle. Backus defends it all.
You should talk to the people that benefit from our services, and I can assure you, we work hard.
That's exactly what KARE 11 did.
You're looking at your records and they billed your insurance for counseling sessions you did not get.
Yes.
Kumari Robinson, he goes by Q, went through addiction recovery at Evergreen. He shared with KARE 11 his treatment and Medicaid billing records.
That is a lot of money.
Money he says Evergreen overcharged his taxpayer-funded insurance.
Yeah, no, I wasn't in group that many times. There's no way.
You're sure?
Yeah.
Like 100%?
100%.
Here's 3 examples. On September 21st, 26th, and 30th, 2022, Evergreen billed Medicaid $70 each day, claiming Q received group therapy. On those same days, Q has time and date-stamped Snapchat photos of the paper route he was working. He says he never went to Evergreen on work days.
You know for a fact you were not in group sessions on those days?
Yes.
Zero doubt?
Zero doubt.
Backing up Q's claim, his Evergreen treatment records have no documentation of service to justify the billing.
We've had DHS here multiple times combing through any and all of our billing, and we've been given a clean bill of health every single time.
That's just not true. An open records request to DHS reveals they've repeatedly flagged Evergreen's billing. Example, February of 2023, DHS issued this warning. Evergreen Recovery has billed for peer support and group treatment services where there is no documentation for the service. It is a crime to provide false information on billings for medical assistance payment. So, just how much public money is Evergreen getting? State data reveals in 2021, it was $3.1 million. In 2022, it jumped to $6.5 million. Last year, it exploded to more than $21 million. That's $31 million in just the last 3 years. Evergreen says they bill a lot because they're helping so many people.
Now, when we're serving 600 clients, do mistakes happen? Absolutely. Is it fraudulent behavior that we're trying to put into place? Absolutely not. If we find anything that happens, we go back and we fix that.
KARE 11 spoke with these 3 former Evergreen employees who all told us there was blatant and widespread false billing. Before we get to them, just know Evergreen's owner has this to say about their allegations.
That's absolutely false.
Absolutely false.
Absolutely false.
Why are you sitting here today? Because I no longer am okay with my complacency.
Ethan Warren is a nurse who worked at Evergreen running group addiction counseling. He says clients would come to a session for just minutes, sign in, and then leave, but get billed as if they were there for 4 hours.
They were billing for people as if they were there for the whole time, even when you knew they were not.
Correct, yes. I was just told to put them on the attendance and then just bill them for all 4 hours that they were supposed to be there.
It appeared to me that it was just a way to make more money and just bill.
Tracy Dorr is a former Evergreen drug treatment supervisor who says he raised red flags to management about billing for people not actually in treatment. He says nothing was done, so he quit.
Me, I didn't want to be a part of it anymore because I knew that it was wrong. and it's doing more harm than good.
They're not in group, and they're putting them in group.
Leah Jondal is a certified peer recovery specialist who worked in Evergreen's attendance office. In prior reports, KARE 11 documented how Evergreen had peers billing Medicaid astronomical amounts. In one case, a peer billed for 203 hours of work in a single day. Leah showed us how she was instructed to falsify phone call billing records and overbill for van rides. She also says she witnessed clients billed for group treatment who never came inside the building.
They'd hang out in the parking lot, but they would get billed for 4 hours a group.
That's exactly the scenario Q describes on a number of days where his records claim he received drug treatment.
I wasn't in group. I would either sit outside or I wouldn't be there at all. And I won't lie, like I was at the time sometimes selling weed and there were people up there that would buy it from me.
You heard that right. He said Evergreen billed taxpayers for providing him drug treatment when he was actually selling marijuana to other clients. We've confirmed through multiple sources that there is a joint federal and state attorney general investigation underway into Evergreen Recovery. With Recovery Inc., I'm AJ Legault.